KCU medical and dental students are now serving as health advocates, partnering with community organizations to support patients beyond the exam room. Dr. Catherine Satterwhite is the executive director of the Center for Population Health and Equity at KCU Joplin. Longer title than yours,
yes.
And joins us with details on the program. Thanks for joining us today.
I'm glad to be here. Thanks for having me.
You do a lot of things, so they have to put all that in there in that title to cover it, I guess.
Long. It is, and I have a long name, so it's
that's
a double
true.
whammy.
It took quite the introduction, and that's all the time we have for this interview, right? So tell us a little bit about this program.
Yeah, so one of the things that I did when I was starting this center is talk to people to figure out where there were opportunities to support the populations that KCU serves. And one thing we heard is there is this opportunity to bridge between where people receive their health care and what their lives are like at home. So our student health advocates really try to work in that space. So you might see a doctor and you get all these instructions and then you go home and it's a lot. So sometimes you need a little bit of a warm touch to figure out how to deal with that.
I thought that was the best way when we were talking, how you described it. It's that warm touch. So how does this work? How do we take advantage of this program? What are the students going to be doing to make this work?
So we've currently just wrapped up a pilot program with Mercy Hospital, and they were fabulous. So shout out to Mercy for being really a wonderful partner. What we were doing is when patients would get discharged, they'd been in the hospital with heart failure, they would be sent home with all these instructions. So our students would then step in and they will call those patients and a couple days after they get home and just check in and see, like, were you able to, it looks like you were supposed to get some prescriptions filled, were you able to do that? It looks like you have a follow-up appointment. Are you all set up to attend? Do you have transportation? Do you have everything you need to really be successful at staying healthy and staying out of the hospital?
This sounds like this is going to be so helpful.
And I'm just thinking about the skills that gives the students when they are later on in the field actually practicing just the bedside manner and just the compassion to work with individuals. So,
absolutely, and that's one thing that we really feel like is a wonderful benefit to this program. Not only are we helping Mercy and helping the patients that have been in the hospital at Mercy, we also are giving our students this chance to really see that health is more than when they're seeing a patient in the exam room or in the hospital, that it's all these other factors and that it's not easy to navigate all those things. So when they tell a patient, go get all these prescriptions filled and I'll see you in a week, that's not actually always so easy.
Sure. I think this is going to be so successful. They're going to want you guys to do this in every department at Mercy, because this would be very helpful. Like we were talking about when I got sent home with my baby and I called because I had questions and they said, well, it's in your paperwork. Oh my goodness, I couldn't read all that paperwork. So this is going to eliminate some of that.
Well, I think it's just an extra help.
An extra help.
And it really is something that we actually are going to be expanding with Mercy. And we're really excited to see how we can continue to really, again, keep people on their health journey, and it looks different for everybody, right?
Sure.
So that's why it's important for us to really have students connect with individuals and try to maybe build a relationship with them so they have another person in their court on their team.
That's right. Now, how can we find out more about this? Where can we go?
KCU does, so the Center for Population Health and Equity is on our website, and if you do have questions, you're welcome to email us, and the email address is on there.
That'll be great because you can find out more information. This will be great for the patients. It's interesting for the students that are thinking about going to KCU. Yeah. Because it's just another aspect of their career that they're going to learn about. We love KCU.
And we love being on here.
Yes.
I want to say, I think I've been, probably when people are hearing me speak, they're thinking that this is just a medical student thing. It is not. We actually have our dental students and our medical students working together because we know that health is more than your teeth, and it's more than your body. It's all of it together.
Yeah. That is exactly true. Well, we thank you for being here with us.
My pleasure. Thanks for having me.
We saw your website. We'll check that out if we want to find out more.